Hello class, I am Professor Rousseau and you are on Apostrophe podcast and you are following class and session. Today I will be talking about Medicare. What is Medicare? Medicare is a health insurance program that is funded by the federal government who are eligible for Medicare. If you are 65 years or older, you are eligible for Medicare. Also, if you can be younger, if you have certain disabilities, some qualified disability, you are also eligible for Medicare. The third type of people who are eligible are people who are suffering from some what they call end stage renal illness. So 65 years old or older, younger individual, regardless of age, who have certain qualified disabilities and people with end-stage renal disease are eligible for Medicare. There are five parts of Medicare. When it's time for you to enroll in Medicare, make sure that you talk to someone, a professional, an expert who will tell you which part provides you the most benefits or which part is most appropriate for your health condition. The first part of Medicare is Part A. Part A, if you require to stay in a hospital to receive care, this is what you will use because Part A is for inpatient services. For inpatient hospital stays, is for hospice care, also some skilled nurse facility, and if you require room and board, Part A will cover all that for you. The second part is Part B. Part B is for outpatient, mostly family practice or primary care. If you will require some routine checkup, doctor visit, you will enroll in Part B of healthcare. Part B for medical insurance is outpatient care, doctor services like checkups, preventive services, primary care, and some health care that your condition will require. Now, let's talk about the third part, and let me tell you first that Part A and Part B, they are considered as original Medicare plan, and down the road, I will tell you exactly why they call them as such, original Medicare plan. Let's now talk about Part C. Part C is also called Medicare Advantage Plan. Why so? Is because it's something extra that you have, and for you to be eligible or to have Part C, you have to have first Part A and Part B. As a check on learning, Part A is for hospital stays and patient, and Part B is for outpatient. Still talking about Part C, what you need to know is that it covers everything. It combines Part A and B, but it adds something more. It adds vision and eye care. Once again, when you are applying for a Medicare, make sure that you ask somebody which one will give you most benefits. Part C for Medicare Advantage plans offered by private companies. Down the road, later we'll be talking about HMO and PMO. So they are offered by private companies, and they offer the same things that Part A and Part B offers, except you can add vision and dental for regular checkup. There is a fourth one which is called Part D. As you can see, Part D is really important. Part D covers prescription drugs. It just allows you to purchase drugs as a discount. You go see a doctor, the doctor will give you a prescription, and you will go to CVS or wherever you go to Walmart to get your medication, and you will be paying what we call a copay. Down the road, I will tell you more what copay is. But remember, either one that you want to enroll in, make sure that you talk to someone. Part B is for prescription drug coverage. When you need a prescription filled for your medication, Part D help you offset the cost. It will make your drugs, your medication more affordable for you. Like any other insurance that you have, there is something called copay. Copay will the amount of copay you will pay will depend on specific services, meaning that everyone will pay different. Let me give you an example of copay. Let's suppose you have Medicare, whatever plan you have, you go see a doctor and your bill is $1,000. You have a copay, your plan could be 80-20 or 70-30. Let's say that a Medicare will pay 80%, which means the 20% will be what you will be paying. What you will say 1,000 of 200 of 20 is maybe 200. So the first 200 you will be paying that your copay. You will pay and Medicare will pay the doctors whatever is left for. This is copay. Let me tell you also part A and B, they may have different cost sharing arrangements. It might also be different for part C and also different for part B, and your copay will determine how much money you will pay for your drugs, how much money you will pay for your room and board, and also how much you will pay for your outpatient or your dental or whatever you go to, whatever service you're getting from your doctor. It is important to understand those parts. Why is it important? It's important because you need to know how they work together. They work together to help you tailor your plan, to tailor your coverage. That's why you need to understand them. And if you don't understand them, talk to someone who knows them. When you know the difference, you will be able to know to find coverage that will be specific to your healthcare needs. But always remember, it is always important to explore available options and choose the plan that aligns with your personal preferences or your health requirement. As I said earlier, for you to receive Medicare benefits, you have to enroll in Medicare. Enrollment typically begins 3 months before your 65th birthday, and enrollment lasts 7 months. You can also enroll the month of your birthday. Either way, it will last 7 months. If you decide to wait and you don't apply whenever is your time to enroll. If you become sick, you have to wait till your enrollment is approved to receive Medicare benefits. The reason they allow you to have 7 months is because they don't want you to have any gaps in your medical insurance, especially for Medicare. For you to understand better, let's take two scenarios, two examples. Let's take example one for you. Let's call somebody Jerome. Let's use Jerome as our test subject, as a guinea pig. May 1st, Jerome will turn 65. When can he enroll in Medicare? Let's say first, 65 years old, he is eligible to receive Medicare, but he has to apply. The earliest that Jerome can apply could be 3 months before his birthday. 3 months before 65, let's say 3 months could be as early as February. February 1st, he can start enrolling in Medicare. And since enrollment lasts 7 months, so he has up to let's say February 1st, March 1st, let me say September. He has up till 1 September to apply for Medicare to receive Medicare benefits, whether it's Part A, B, C, or D. Now, let's take the second example. Jerome will be still 65 May 1st, and I said before, 2 ways you can enroll. So now he can wait till May 1st, the day or the month of his birthday, when he turns 65, to apply, because Medicare enrollment lasts for 7 months. He has till, let's say, January, he has till December 1st to enroll in Medicare. Enrolling early or 3 months prior your birthday will ensure that you have no gaps, because if you become sick after your birthday, you will not be covered and you have to wait till your enrollment is approved to receive Medicare benefits. There are several myths and misconceptions regarding Medicare. Let's go over them. But first, let me tell you that Medicare does not cover everything, meaning that some health conditions that you have will not be paid by Medicare. That's why when you sign up, make sure that you understand the basics of Medicare. And this is why that some individual who sign up for Medicare, they also sign up for additional coverage. There are several out there, but there is one that works alongside with the original Medicare plans. Can somebody remind me of what they are? The original Medicare plans. Yes, Part A and B, they are the original Medicare plans. They sign up for the additional plan called Medigap. Medigap is also known as Medicare Supplement Insurance. One thing for sure to know about this is a private insurance service. They are talking about here private insurance, and down the road later I will be talking about HMO and PPO to make you understand better. So now let's focus on Medigap. Medigap, also known as Medicare supplement insurance, is a private health insurance that is designed to supplement, to fill gaps in insurance and coverage that is left by the original Medicare plans, which are Part A and Part B. Those gaps, they may include what we call deductible. It may include also copayment, copay, or co-insurance. Earlier, I spoke about 80-20. It could be 70-30. It could be 60-40. It could be 50-50. Let me make you understand better. It's something that we use every day. If we drive a vehicle, if you have an insurance for your automobile, when you sign up for your insurance, they will ask you what is your deductible. It could be $50. It could be $250. It could be $700. It could be $500. Let's use $250 an example. You have an accident. You take your vehicle to the shop, and your vehicle to repair it will be $1,500. Your insurance will not pay the entire $1,500. You will check your policy and you will see that you have a $250 deductible. Practically, you will be paying the first $250. Now, let's imagine that your total bill was $251. Your insurance will only pay $250, only $1. You will pay the first $250. Same thing for your house. The same thing applies when you go see a doctor. You pay a deductible or you pay some co-insurance. Your contract will tell you what you need to pay. Same as Medicare, that has several parts, Part A, B, C, and D. Medigap also has some standardized policy. They use letters to understand them. Once again, for you to understand those letters, check with a professional. Medigap A, B, C, D, F, G, K, L, M, and N. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So they have 10, at least 10 standard policies for Medigap. You will pick which one that you want. And once again, I advise you to carefully compare these plans to understand the coverage before you choose a Medigap policy. Let's do a recap. So we can do our check on learning. Today, I spoke about Medicare. What is Medicare? Is a health insurance program, and who pay for your care is the federal government, not the state. The federal government fund Medicare, and for you to be eligible, the first criteria, 65 years old. You can be younger, but you have some qualified disability. Check with a professional to tell you which disability qualify for that. And also, or you can be an individual with a end stage renal disease. Those are those people who are qualified, eligible for Medicare. And Medicare, the enrollment start 3 months prior to your birthday and last up 3 months after your birthday or on the day of your birthday. Medicare offers several coverage. It's about options. Coverage options. One of them is Part A, we have also Part B, we have also Part C, we have also Part D. Part D is for medication. Part C is the gap, is offered by private insurance. Part B is for outpatient, and Part A is for authorization. What? Why do you have to have it? Is because you never know when you will be sick, and if you know your health is not that great, always try to have a to have the Medi gap to fill the gap in coverage that is left by Part A and Part B. This concludes my class today on Medicare. You are on Apostrophe Podcast, and my name is Professor Rousseau. Next week, come back so I can give you better advice to plan your retirement, mostly how to protect your assets so you can outpace inflation when it's time for you to retire or when you leave assets or money for your kids. Thank you. See you next week.